Good morning everyone, it's Amy here from Pulse Dermatology and Laser. Today I thought I would just check in and come and talk to you all about one of our most popular treatments at Pulse. We have so many patients that come in with concerns of pigmentation, rosacea, so the red flushing on the cheeks, little veins on the side of the nose, and then they also just want to sort of even out the color of their skin and rejuvenate it, get a little bit tighter, get a little bit smoother, work on the little fine lines. And when this is the case, if they are a candidate for treatment, I would always recommend our Ipl Laser Treatment. Now, Ipl stands for Intense Pulsed Light. So it is a light that sort of flashes across the skin. And it's a broad spectrum light, so that means it can do sort of a lot of different things. It picks up on a lot of different colors. So not only is the heat that is emitted in the treatment going to cause a contraction of the collagen bands in the skin and put the cells in the skin under just enough attack so that they feel like they need to produce more collagen, so it sort of rejuvenates your skin naturally. You start to produce collagen naturally. But it is fantastic for treating any sort of deviations in color on the skin. So it runs across the skin going, no pigment, no pigment, no pigment. And then when it finds pigment, it sort of latches onto that, creates a little explosive reaction in the skin. And that pigment is then broken up and either absorbed in, especially when we're treating little vascular lesions, little broken veins on the cheeks and the nose. But also with sun damage, it will break it up and it comes up to the surface of the skin. It almost looks like tiny, tiny little coffee grounds on the skin. It's not something that's rough. You can't pick it off the skin. It sort of sloughs off after 7 to 10 days. And then the skin looks really, really smooth and healthy. And the pigmentation will be a lot lighter. But yes, it's a really, really safe treatment, and if it's done with the right practitioner. Now, I've been working with various different types of Ipl lasers for the last 15 years, and we've got a beautiful machine that not only incorporates the Ipl laser light, but it also has what we call RF or radio frequency, which just gives you that little bit of extra tightening as it heats the underlayer of the skin. So who does the treatment? We have obviously a lot of women come in with sun damage on the skin and rosacea, but we've got about 50% of the patients that come in are actually male. Men don't wear makeup, and so they want to treat the little veins on the cheeks and any sun damage. So we've got corporates, surfers, and so there's such a wide spectrum of patients that we treat. When would we not use Ipl laser on pigmentation? Definitely if it is hormonally driven pigment. So your melasma and your chloasma, those patients are not a candidate for it because the heat can actually aggravate it and make it a lot worse later on. So we have other procedures in place when patients are struggling with hormonal pigmentation. You would also not do it if someone was epileptic or photosensitive epilepsy in specifics, because the bright flash would not be safe in those cases. But other than that, it's like a really safe treatment. It's got minimal downtime. Within a week, you're completely healed, but most patients can have the treatment in their lunch break. And we recommend they normally say about 6 treatments, but 90% of patients that come in, I say start with a package of 3. We do it once every 4 weeks for 3 sessions. And we can normally get a really, really good improvement in that, and a lot of patients won't need to carry on, maybe only maintain a year later. So if you use really good sunscreen at home, you can really maintain your results, and we're having wonderful effects. So if you have a look at all the photos that we will add in at the end of the video, you'll see some of the amazing results that you can get with our Ipl laser treatment.